12:30. So we're going to go ahead and get started with the webinar today. We're talking about vision, behavior, and attention today. And I'm Dr. Valerie Frazer of New Horizons Vision Therapy Center. So let's talk about why we're even talking about what vision has to do with attention. So it's important to note that children with vision dysfunctions are 2 to 3 more times more likely to have ADHD like behaviors. So why is that? We're going to talk about that today. And what does that mean? So first, let's talk about what we mean by ADHD. There's considered to be 3 types of attention deficit disorder. So there's the inattentive type of ADHD, and the hyperactive impulsive type of ADHD, and then a combined form, which basically means it has features of both types. Let's start off with the inattentive type of ADHD symptoms. So if we look at what those symptoms are listed as when they go to basically diagnose ADHD, this includes not being able to pay attention to details, making careless mistakes, failing to keep on task, not listening, being unable to follow or understand instructions, avoiding tasks that involve effort, being distracted, being forgetful, and losing essential pieces or items required to complete a task. So if we look at those behaviors and then we look at which ones are related to vision, the ones in red have a high association with the type of vision problems that I treat frequently. The ones in yellow have some association, but there can be other factors that are also involved with the ones in yellow. So let's take a little bit closer look at why that is. I think most of the symptoms that you're seeing here, you probably would think a lot about what happens in a school situation, trying to read, write, and do the type of problem solving that's involved in school. So when we look at the type of vision problems that can interfere with that attention, it's important to understand what we mean by what does it mean to have very good visual skills. So typically when we think about good vision, we're often thinking about what someone can see on the eye chart, so 20/20 vision. And it's true that there is association with poor attention and vision impairments, meaning that being unable to see 20/20, whether that means with or without glasses. But it's not the only thing and not even the most prevalent thing that causes difficulty with attention. Because the ability to see 20/20 vision at distance does not predict academic success. So many kids can have 20/20 vision and still have trouble with their visual skills, mainly depends on how you, again, define visual skills. So a lot of these deficiencies have to do with how the eyes are functioning at near for reading and writing and math. And how the child is functioning near can really significantly interfere with how they're able to pay attention. So what types of visual skills are related to attention? So today we're going to talk about these visual skills. We're going to talk about eye teaming, eye focusing, eye tracking, and visual processing. Those are the 4 main areas that can cause difficulty with attention, especially in the school setting. So let's look at eye teaming first. So what do I mean by eye teaming? Well, you have 2 eyes. Each eye has its own picture. And in order to see single and clear, you have to make those 2 pictures become one. At distance, the 2 eyes are straight. When you look up close, they have to converge on each other. As you can see in this picture, the 2 eyes converging on one point. So they need to be, each eye needs to be pointing at the same place at the same time. And when that happens, then you should have clear and single vision. Good eye teaming is also what gives us depth perception, 3D vision, and it also is very important for eye-hand coordination, especially during gross and fine motor tasks. If you don't do that, this is an example of what it could look like if you're having double vision. It's another example. So it makes it a lot harder for reading, being able to separate where each word is. Some people describe things as seeming like it's squished together, like it's crowded, and it becomes difficult to look at and comprehend. So poor eye teaming skills can also lead to eye strain or headaches if they don't always um, have a blurry or double vision right away, but definitely increased effort to try to keep things clear and single would lead to some eye strain and headaches. Um, it can interfere, as you can imagine, with reading fluency and comprehension. It also can cause behaviors such as difficulty with attention, of course, and avoidance of behaviors. So I see a lot of avoidance behaviors, um, especially in younger children or kids who maybe aren't as interested or motivated to do their reading. Whereas the children who are motivated to read will tend to go more for the eye strain or headaches because they persevere through that. Can cause reduced depth perception, which again, it can interfere with eye-hand coordination, and difficulties with handwriting, the spacing in handwriting, writing up or downhill, and then lining things up in math can all be related to poor eye teaming skills. The second visual skill we're going to talk about today is the visual focusing skills. The medical term for that is accommodation. So accommodation occurs in the eye. There's a lens inside the eye that's controlled by some muscles, the ciliary body, that move in order to make the image clear on the back of the eye, the retina. So when you look far away, those muscles relax to clear things far away. And when you look up close, those muscles have to do some work to get things clear up close. So when we talk about accommodation, we're talking about both the ability to sustain and maintain that clear vision in each eye up close, but also about the ability to switch back and forth quickly from distance and near. Generally, this skill develops about 4 months of age, and when we start to reach um, later adulthood, usually around age 40, that lens inside the eye gets harder to move, and so that's when people tend to need to go to reading glasses or bifocal lenses. In kids, though, it should be easy and automatic. What happens for some kids is rather than having blurry vision at near, sometimes their eyes work really hard up close and then have trouble with the relaxing of focus to see far away. So if things are not working well with that focusing system in the eye, then you can have blurry or distorted vision and a lot of symptoms similar to what you would see with eye teaming problems. So again, increased effort to keep things clear might cause some eye strain or headaches or rubbing of the eyes. You might notice difficulties with the reading fluency and the reduced comprehension when reading, difficulties copying from the board, again, switching that focus, that visual focus from near to far, and again, that creates difficulties with attention and avoidance behaviors as well. Visual skill number 3 that I want to talk about is includes the eye tracking skills. So what do I mean by eye tracking skills? Well, there's 3 main ones I'm going to talk about. So fixation is just the ability to be able to hold your gaze and maintain your fixation on an object. So just being able to hold your eyes still and look at an object. Babies learn that usually right away within the first few months of life. A saccade is the ability to move your eyes from one point to another accurately, and pursuits is the ability to follow a moving object. So to talk about what these eye movement skills do for you, probably the one that affects most reading is the saccades. So in this video that we're seeing here, we see the person on the right has very good saccades. They're basically, their eyes are moving along like they're supposed to accurately. You're not seeing any skipping, and everything looks smooth. So the little bar there that's going across is basically measuring what an eye recording that's measuring what the eyes are doing as they're reading. This compared to the person on the left who is eyes are skipping around a lot. They lose their place. They don't go back to the beginning of the line accurately. In reading, what we want to really see is this kind of typewriter effect where the eyes move around smoothly around from left to right accurately, and then again, when they get to the end of the line, they go back to the beginning. So the person on the left is not doing um, as well a job with that because their eye movements are having difficulty. So of course, then what we can see with poor eye tracking skills is difficulty with keeping your place when you read. And it can also affect handwriting. Um, if the eye focusing and the eye teaming skills aren't working well, a lot of times those two skills will interfere with the development of good eye tracking skills. Another thing we look at is, are they able to track with just their eyes and without their head? So generally around age 6 or 7, they should do a pretty good job of being able to just track with their eyes and not have to move their head a lot if the eye um, movement skills are well developed. This also plays a role in sports, and of course, like tracking a ball would be more of that pursuit that I talked about earlier. Is following a moving object. Again, that all goes to having good eye tracking skills. So kids with attention problems tend to have a lot of difficulty with eye tracking skills. Sometimes it's because, like I said, the focusing or the eye teaming skills aren't well developed. Um, but that's something that we definitely work on. And all this, so if you can imagine all this increased effort to use the eyes for things that should be pretty much subconscious, leads to, fatigue, avoidance, or inattention. But it can also lead to a lot of frustration, which leads to some more acting out and behavior problems. Not understanding why they're struggling and why they're having so much difficulty. Visual skill number 4 that we're going to talk about is really more of a set of skills. So we're talking about visual processing or perception. Perception is interpreting what you see. I'm going to briefly go through a couple of different areas here, but I actually have a whole webinar presentation that's all on visual skill number 4, visual processing, that you could watch off of our YouTube page or website. So visual discrimination is the ability to notice details. So, this is one where, okay, if your focusing and teaming skills aren't working really well, you might not notice all the details and have a hard time with that. But it's also a skill in and of itself that can be trained. Visualization is being able to picture things in your head. So this really applies to not only reading and reading comprehension and spelling, being able to picture the word in your head, but it also applies to being able to listen and follow directions. So if you can visualize the task before you do it, you're better be able to follow that direction. So a lot of kids with trouble with listening sometimes also have trouble with that visualization process and understanding what they're supposed to do. Visual memory is being able to remember what you see or where you saw it. So visual memory goes, again, to some spelling things as well, but also has to do with remembering where you put your boots and remembering where certain items should be. Visual figure ground, that's being able to find things or what you're looking for in a crowded background. So if you have a lot of things around and you're having trouble finding things, that would be visual figure ground. So one of the things that we associate oftentimes with attention deficit disorder is, poor organization or being unable to find what they're looking for. So that again goes to some visual ground skills. Visual directional skills, that's being able to understand concepts of right and left and up and down. A lot of kids get the up and down concepts pretty well, but often struggle with rights and lefts. And so in school, you can see that with more letter reversals or trouble knowing which way the letters go. Confusing of B's and D's. But also, again, has to do with following directions and listening. So if you say, go get your backpack, it's on the right of the table. If they don't know what right and left is, then they're going to have a hard time with those directional skills. And then visual integration skills, which we're going to talk about a lot coming up here, is how does the visual system integrate with other systems such as auditory or hearing and speech, vestibular, which is your kind of inner ear and balance, and then your motor system. Because that kind of leads us into looking at the other type of attention deficit disorder, which is the hyperactive impulsive ADHD. Now, when kids have this type of ADHD, the hyperactive and impulsive, a lot of times there's more than one thing going on here, and vision is kind of a part of it. So definitely the fidgeting, squirming, sometimes can be seen as also avoidance behaviors, routinely getting up while seated, running or climbing at inappropriate times, having trouble playing quietly. Those are the ones in yellow all have some vision component. So the often on the move or is propelled by motor also has a vision component to it. The talking out of turn or blurting out, interrupting, I didn't necessarily, those, you could make a case for some social cues that happen visually for that sort of thing, but we're not going to directly relate to those to vision for now. So let's talk a little bit more about that, because it's probably a little bit harder to understand about how this hyperactive component can be related to vision. So my mentor, or one of my mentors, was Dr. John Stropp, and he's quoted as saying, "When vision leads, it guides. When it doesn't, it interferes." So this is what we're talking about with that hyperactive impulsive child. Oftentimes their visual system is given maybe a little bit of faulty information, or they're not using it to the best of their abilities. So children with the hyperactive impulsive type of ADHD may be having trouble using their visual system to really guide their actions. So they try to make up for it using other systems, such as touch or tactile. So they might have to touch everything rather than really just exploring it with their eyes and visually and understanding it. So the other thing that goes into this also is just trouble filtering visual information. So you think about that they might get really distracted by other things that are in their visual field, that they're not necessarily their main focus. There's a lot that we kind of tune out in our daily lives. We're not constantly having to, every time there's a movement in our peripheral vision, turn our heads and look at it. Usually we can tune out certain things that are important and attune to those things that we need to. So a lot of times there's this difficulty with kids with the hyperactive impulsive type of ADHD, where they really are not using their central and their peripheral vision as equally as they should. So sometimes it means that if they are really trying to attend to something, let's say they're tracking something or have an activity that they're really tuned into, maybe it's a video game, because that seems to be what often attracts kids. Maybe they tune out the whole entire rest of the world while they're able to do that. So they're really not using their peripheral vision the way that it should. And then we might have someone who's the opposite, where they're constantly noticing things in their peripheral vision and redirecting their attention because they see, again, something in the peripheral vision catches their attention, but then have trouble with sustaining that focus centrally for very long. So they might not be able to sit and play a game, which is a more, like say a board game, that's more, again, your central vision that's kind of working because they're distracted by everything that's in their peripheral vision. So these are a little bit harder concepts to kind of grasp, but really relate back to some of the things that happen with the eye tracking skills and the eye teaming skills. For instance, if I'm going to track and follow a ball, if I don't have awareness of my peripheral vision, I'm not going to see where it's going, so I'm going to move my head a lot more rather than just my eyes. Or if let's say I don't move my head and this ball is like moving in front of me, then I'm going to have hard time looking at it and maintaining my attention on the ball, even though my head might not be still. And a lot of this comes from really understanding where we are in space. So a child that has trouble with answering these where questions oftentimes will get more easily distracted. So vision tells you about where you are in space in relation to other objects, but also where those other objects are in relation to themselves. It's the main visual tool that we use to explore our world. The vestibular system, as we talked about before, that has to do with knowing where you are in space using, it's more that balance system that's going on. So that's answering another type of where question. Auditory, where is that sound coming from? Again, there's this where component to the auditory. And then tactile is more, I guess, less so about the where, except for like, where is it touching me? And then the proprioceptive, that's a medical term, has to do with understanding where the information we get from our joints about where we are in space as well. So the main overall thing I want you to take away is that vision is not just a what is it system, but it is also a where is it system. And these visual, the vestibular, and the proprioceptive especially all work to direct and coordinate the motor system. So you don't often think about it, but your vision is like your GPS system. It tells you kind of, where to go or how to maneuver around the world. If that where system's not working well, you're going to have some difficulties. So again, ADHD, especially this hyperactive and attentive type, is also in a more complex visual system where vision is a piece of the puzzle. And it has to do with, again, this awareness of space and the body awareness. A lot of times, these patients will benefit greatly from, also, in addition to vision therapy, is looking at what we call sensory integration, or being able to integrate the information from the vestibular, the proprioceptive, the auditory, as well as, and again, has to do with how we filter that information as well. So a lot of these kids would benefit from occupational therapy that has a more sensory integration slant. Other factors to think about when we're talking about attention problems would also include things such as diet. Are they getting the nutrients that they need? Sleep, are they getting the sleep that they need? Are they having sleep issues that are interfering with their attention? One of our big difficulties with sleep has to do with how much screen time we're getting, especially towards the end of the day before bed. It can really interfere with sleep, so try to turn off the screens at least 2 hours before bedtime to ensure that those screens don't actually interrupt with the sleep patterns. A lot of new research has come out about the difficulties with screen time, especially right before bed. And then looking at allergies and possible food sensitivities. So if there's like dark circles under the eyes a lot, sometimes there's an allergy problem or a food sensitivity problem that's going on that can interfere. And then in general, other medical problems that can also interfere. So let's talk for a minute just about what is optometric vision therapy. It's a progressive, individualized program. Progressive meaning that we start with where the skills are at, and then we build on them and build on them and build on them. Individualized to each patient, so each patient's going to be different about what their needs are and where everything is at. It may include lenses or glasses that are prescribed not necessarily just for or eyesight, or maybe the child doesn't have any eyesight problems, so they're not for that, but they're more therapeutic and working more on helping the child understand that where system or use their visual system more efficiently, or help them more effectively filter that visual information. So it's one tool that we use as part of an overall program. And this tends to be a specialty of optometry, not ophthalmology. So ophthalmologists tend to be eye surgeons, don't get training in vision therapy. So doctors of optometry, like myself, usually specialize in it, go through additional training, or in my case, like a certification program in order to be able to effectively administer this type of treatment and even to diagnose what's going on. If you have any questions about what I've gone over, you can feel free to email us at info@newhorizonsvisiontherapy.com. You can also check us out on Facebook. A lot of good things that we post on there that has more information. And also, you could sign up for our newsletter off of our website. Other organizations that have other information include the COVD website, that's College of Optometrists and Vision Development. So thank you again, and have a great day.